Hello and good afternoon once again. Dr. Alalade here at Ask the Gynecologist, and today is a wonderful day as always. I'm your host here at Ask the Gynecologist, and this afternoon is going to be an open session, an open question and answer session. So if you have questions, I would like to take them, but please, I want us to be organized a bit in the sense that whenever I'm answering questions, let me answer that particular question, finish before you pop another question so that I don't miss questions. Because if you put questions quickly, I'm human now. Before I finish answering a question, you put another one, I'll probably not see that one, I'll probably miss it. So please be patient while I answer questions. And sometimes most people's questions are already answered. So don't not because I'm answering someone else's question which is similar to yours, don't assume that I have not answered your question. You just have to listen to those answers, okay? And once again, I want to say good afternoon to you all. My name is Dr. Babajide Alalade, one of your admins here at Ask the Gynecologist, and we are live simultaneously talking on Instagram and also on Facebook. I'm trying to see a way how I can adjust my camera so that we can all see the whiteboard while I'm talking. But anyhow, I'm still trying to adjust my studio. I've not really gotten the best position for this. We're working around the clock to ensure that people get the best service and get the best experience in ATG. A question here by Agege. She's saying that how long can I wait to get pregnant after fibroid surgery? I'll suggest a minimum of 6 months. Allow your body to heal minimum of 6 months. But there's no hard and fast rule. Some will say 12 months, but at least get your body to recover for at least 6 months before you start trying. Thank you, Christina Alalade. Wonderful. If you have any beautiful picture of yourself, please send it and publish it on our Facebook page. We'll get it accepted. So we are letting ladies and members of our group share their beautiful pictures. We want to celebrate women. Women are beautiful people. God has created women to be beautiful, and we celebrate that all the time in ATG. So if you have a picture of yourself, please share it up on ATG group page. We will get it approved and we'll share it to our members, please. It's a question here by Adebayo Taiwo. How can high UFD be prevented in next pregnancy? IUFD is intrauterine fetal death, basically intrauterine fetal demise or stillbirth. To be honest with you, there's no particular way to prevent stillbirth. A lot of things increases the risk of stillbirth in pregnancy. So, for example, thyroid problems in pregnancy, diabetes in pregnancy, blood pressure problems in pregnancy, the infection in pregnancy, all these, so on and so forth, even chromosomal problems in pregnancy. Some things are preventable in pregnancy, and once you prevent them, stillbirth will be reduced. Some things are not preventable. I'll tell you something, even ordinary C-section increases the risk of stillbirth in subsequent pregnancies. So we will do the things we can do to prevent, okay? And the things we can't prevent, we have to work and monitor the pregnancy. So the best way to prevent stillbirth in subsequent pregnancies is to have proper antenatal care and ask the proper questions. That is why you need to join antenatal service. It is proven that people that have regular scheduled antenatal services and advice from a doctor are in most cases able to prevent stillbirth in subsequent pregnancies. So it's important that you join an antenatal service group. I hope everybody can hear me. I've not tested my audio. If you can't hear me, let me know so I can increase my volume. But if you can hear me, that's fine. We also have a question here. Let me see. I think. So anyway, people are watching on. There's another question here on Instagram. Doctor, good afternoon. What can be done or drug to ease smooth penetration? Lubricant. Pre-seed lubricant can be used to ease penetration and make it easier for sex. My princess, Alison Silk B. Mina is asking, how is my princess? She's doing fine. She's just having some feed just now, and thank God for her. She's beautiful, and thank you so much, Alison, for checking up on princess. TG Omotalani, thank you for letting me know that you can hear me clearly. Omotalani, thank you so much. Omotalani, send your photo to ATG so we can publish your photo on our general page, okay? Doctor, please, I'm 44 years old and my period has stopped since 2 years now. What can you use to have your period come out? First of all, we need to know that are you still ovulating? And have you not gone through that ovarian failure phase? So we need to do your FSH hormone to know if you're still ovulating. And if you're not ovulating anymore, probably you've gone through the I'll say ovarian failure or menopause, then we cannot change the things back. How do we know that? You do your hormonal profile test, FSH, okay? And then you send the results to me through the ATG premium services, and I'll get back to you as soon as possible. Fumilola Olatunji Oto is asking, Doctor, I need your phone number. Fumilola, there's no way in the world I'll put my phone number on Facebook like this. If I do, this discussion will not continue. People will start calling me and I won't be able to continue this discussion. So there's no way I'll put up my number on a general Facebook group of 1.7 million people. Otherwise, I will not sleep. Remember, I have to go to work too. I do work on labor ward. I work on calls. And so if I put my number here and everybody's calling me, even the people that are subscribed, if they are calling me every day, I will not. That's why you have to respect God. God listens to everybody every day, and God is never tired. So it's not easy. So I can't put my number here on Facebook. If you want to talk to me, go through our ATG premium services, okay? Doctor, are COVID vaccines safe for pregnant women? They are safe. There's no to COVID vaccine. If you have not received your COVID vaccine, get it done now. Before, people were not sure, saying that people should avoid it if you're going for IVF, but now I think it's been proven that it's safe. So you can get your COVID vaccination. So initially, I used to tell people to avoid, but for now, I don't think there's any issues with it. I think they've done enough trial and they're sure that it's okay. But still apply caution and read all the instructions and read all the possible reactions, because there are still some people can still have allergy or reactions adversely to any vaccine, including COVID vaccine. What causes late period after 3 days? Then do test of pregnancy after a week if you haven't seen your period, and then do your hormonal profile. If your period is still irregular after doing all of this, then it's important that you have a stethoscopy, so we look into your womb. It's also good for you to get a scan done to check that there's no fibroid causing these problems or causing blockage in your cervix, okay? Thank you, Elizabeth on Instagram. Elizabeth, one of our team members, is here and she's answering Omotolani. Thank you, Omotolani, for your questions. So Was Young is asking a question. Good evening, doctor, from here. Please, doctor, what is the meaning of these symptoms? Feeling nauseous, backache, bitterness in the mouth, breast pain, tenderness, body pain. Maybe you're pregnant, so do a test of pregnancy. Doctors, someone that had a ectopic pregnancy before and now she's pregnant, does it mean she'll give birth with CS? Yes, it doesn't mean. If you had ectopic pregnancy before, it was surgery on your tubes, or you were given medications to shrink the ectopic pregnancy on your tubes. That does not stop you from having pregnancy and delivering normally. Because you've had ectopic pregnancy before does not necessarily mean that you're going to have a C-section. If for any reason during your pregnancy you are deemed fit to need C-section, then that is fine. But if you don't need C-section, you don't need C-section. Because you had ectopic pregnancy does not automatically mean that you're going to need C-section to deliver. Okay, doctor, I would just saying, doctor, can a stethoscopy and laparoscopy correct infertility? If the causes of infertility needs laparoscopy, needs stethoscopy, you can correct them. You can correct infertility. It depends on what's causing your infertility. If what's causing your infertility can be treated through stethoscopy or laparoscopy, then that's fine. Favor, Akpos, something. Good evening, doctor, from here. Okay, okay. Ami Felix, someone that has okay, I've answered that one. I've answered that one. Let us see questions. What causes slippery discharge on 9th day of period and your cycle is 30 days? Nothing. It's just normal. It's normal. There's nothing. It's normal. Okay. Dr. J, good afternoon. Emi Ikatwa, my wonderful sister. Michelle is doing well. Thank you, Emi Ikatwa from Nigeria in Benin area. Thank you, Emi. God bless you. Omotolani on Instagram, thank you. Valentina Powers, I can see you on Instagram. Thank you guys for joining this afternoon. There's a question here about appendix, and that question keeps going away. Okay. How can some acute appendix be handled in pregnancy? If you have appendix inflammation, appendix abscess in pregnancy, then it has to be treated, because if you don't treat appendix and it ruptures in pregnancy, it can increase the risk of you losing that pregnancy. And in fact, if you have appendix swelling, appendix mass in pregnancy, it must be taken out. It must be treated like any other person. Obviously, going through surgery during pregnancy carries the risk of miscarriage, but if you don't treat appendix problems in pregnancy, if you don't treat appendix abscess in pregnancy, your risk of miscarriage goes up sky high. I can see you there, my sister. I've forgotten your name. Just skipped my mind now. I can see you clicking love there. Thank you so much. Thank you so much. Send a comment. Ewa told me Esabod. She's saying, is pain too much normal post? Ah, that question is gone. What causes pain during... oh God, now questions are too much. I cannot read them anymore. Please, guys, let us slow down with questions so that I can answer them one by one. They're getting too much. I cannot even scroll them anymore. Please slow down, guys, so I can read questions. How can someone... Oh, Jesus Christ. Dorjide, someone that is paying too much post-embryo transfer. 5 days, fresh embryo, 3 days ago, blah, blah, blah. You're paying too much. It could be a sign of urine infection, but if there's no pain and there's no burning sensation down below whenever you go to pee, then there's nothing to worry about at all. But as far as there's no bleeding, there's no pain, that's fine. You're having back pain at 6 weeks pregnancy, is it normal? It can happen. But ensure that your pregnancy is not ectopical. So go and get a scan done to ensure that the pregnancy is in the womb. Get a scan done to ensure that the pregnancy is in the womb, okay? Doctor, what can cause period to stop at day 2 and continue on day 4? It can happen, very well it can happen, but it can be because of fibroid or cervical fibroids, okay? All this can cause the period to be a bit scanty one day, then restart again. So check it out. Doctor, can uterine rupture stop one from getting pregnant again? Yes, uterine rupture can stop you from getting pregnant again. If you've had pregnancy before, maybe you've had a previous C-section before, or you have been induced and you had uterine rupture and you are lucky to be alive, I suggest that you stop pregnancy for now and live your life comfortably. Okay. Doctor, you've been feeling pains in your lower abdomen, you're feeling sick for some days now. Get to see your family doctor or see the surgeon to ensure that you don't have issues with your bowels, okay? How long can a woman take Palodel? Minimum, before you start taking Palodel, you must have done your prolactin level to know what your prolactin level is, to know what the blood level of prolactin was at the onset of you commencing the Palodel treatment, okay? So you take the prolactin for medication for about 6 weeks, then you repeat your prolactin level to see if it's coming down. If it's not coming down, you might need the medication to be changed, okay? Or even us adding something else to the medication, or even changing it entirely, you know? So you should not be on Palodel forever. You should be checking your prolactin frequently, minimum every six weeks, okay? Doctor, what's the meaning of a cystic mass? A cystic mass is that they've scanned you and maybe they saw something on your ovary or on your tube or your womb somewhere or your bowels, and that thing contains a kind of a sac-like structure. It could be anything inside. It could be water, it could be blood, it could be some solid component, it could be anything inside. So a cystic mass is just a description. That's all. Nothing else. Good. Doctor, what's the best treatment for vaginal itching? First of all, we need to know, for me to know the best treatment for your vaginal itching, I need to know what is causing your vaginal itching. Don't forget, I'm not a Dr. Lau. I'm a doctor, not a Babalawo. I can't just say, go and use this and the itching will be gone. Except I don't know what I'm doing. And I'm a doctor and I went to medical school. Precisely, I went to University of Lagos back in the days. I left school 2002. For us to know what is causing your itching, we need to do vaginal swab. We need to examine you. I can't examine you obviously on internet like this now. So you need to get examined, vaginal swabs done at a reputable laboratory. And then for the results, we know what's causing your itching, and then we can profile the best treatment for you. What's the solution to ectopic pregnancy? If you have ectopic pregnancy, 3 ways to treat ectopic pregnancy. Ectopic pregnancy, it can miscarry like any normal pregnancy, but we have to watch it and very critically. We can watch it critically. Sometimes too, we can give medications called methotrexate to shrink ectopic pregnancy based on certain criteria. And another thing you can do is to go to surgery and take the ectopic pregnancy by taking out the old tube, or incising the tube and taking the ectopic pregnancy out only. So it could be managed conservatively, medications or surgery to manage the ectopic pregnancy. Or everything, for us to know which one we choose for you, depends on the patient herself, depends on the level of skills and whatever is available in the hospital, and also depends on how critical the person is and some other criteria which we follow as per our guidelines to know what is the best treatment for that ectopic pregnancy in that particular case. Doctor, what's the best way to treat Asherman syndrome? To treat Asherman syndrome, Asherman syndrome is when you have scar tissue like cobwebs in your womb cavity from previous infection, ectopic pregnancy, fibroid surgery, C-section, DNC, and so on and so forth. So if you have scar tissue and all these things in your womb, the best way to treat it is to go and remove those scar tissue, and we remove it by doing what we call hysteroscopy and resection of scar tissue in your womb, or hysteroscopy and adesiolysis, where we remove all the scar tissue in your womb. It has to be done by hysteroscopy. And I said again, we're going to start this service available at the ATG IVF Center from next week, all things being equal. Worst case scenario, before the end of the month. Okay, we'll start that in the ATG IVF Center. Doctor, I made inquiry at the ATG IVF Center, but you need a follow-up WhatsApp number. So if you've gone to the ATG IVF Center and you've done any test in the laboratory, automatically the staff members will give you out the information on how to get to me. They'll tell you, except you haven't been there. But if you've been there and you forgot to ask them, call them on Monday morning. They are closed now because of the local elections, and then they'll tell you the procedure to get your results to me if you attended our laboratory at the ATG IVF Center. So contact them on Monday. Doctor, what causes small calcified lesion in the endometrial plate and tiny echogenic mass, blah, blah? It could be fibroid, it could be ovarian cyst. Can a pregnant woman take for what can a pregnant woman take for heartburn? You can take your Gaviscon, omeprazole, they all help with heartburn. And avoid eating spicy food too late before going to bed. If you're going to go to bed, stop eating 2 hours before going to bed. If you have to eat and you're hungry, you can take fruits, you can take things that are not spicy, and avoid eating and going to bed straight away, because it will cause reflux and it can be very, very unpleasant. Okay. How can FSH be corrected? If your FSH is high, it can't be corrected. I won't lie to you. What FSH? FSH is just a test to tell you something. It's not for you to treat FSH. If your FSH is more than 30 on 2 occasions apart, and those 2 occasions are a minimum of 6 weeks apart, that means that you're not ovulating anymore. That means that you've exhausted your egg supply, and that is that. If you are 60 years old, can you change your age back to 20 years old? That can be done now. You can't reverse your age. Age is something that is progressive. It's not retrogressive. This is not a case of where you can reverse your age and wind back the hands of time. No, we can't do that. Time doesn't work that way. So if you stop ovulating, your FSH is more than 30 and 2 occasions apart, you're not ovulating anymore, then you've gone through menopause or premature ovarian failure or ovarian failure. At that point, we have to consider giving you an egg donor to get pregnant. Okay, but before we reach that stage, we should repeat your FSH 6 weeks apart, and then we know what is going to happen. Corpus luteum is part of the ovary that the egg was released from, that is essential to support the pregnancy until you get to week 12 for pregnancy. The corpus luteum produces progesterone to support pregnancy and placenta implantation until you get to week 12. By the time you get to week 12 of pregnancy, corpus luteum will regress and shrink. And at that time, the placenta is able to sustain itself with progesterone all through pregnancy to delivery. So corpus luteum is essential in early pregnancy. My sister, I can see you clicking love there. Thank you so much. Your name just skipped my mind, and I can see your clicks there. God bless you so much. God bless you. And I can see Christina Dumoye as well, our admin. Yeah, she's also clicking wonderful things there. How can one who has cervical incompetence, when scans show inner cervix is closed, what is the cause of leakage? How can someone know you have incompetence? Okay, if you have a scan, what we do is we check your cervical length. If it's more than 2.5 centimeters, then it's unlikely that you have cervical incompetence. Apart from the length itself, we also have to check that is the length decreasing. If it's decreasing, then it's falling in, it's getting weaker. So it's not just one scan to say, oh, the cervix is more than 2.5 centimeters in length. Is to check it again, maybe every week or every 2 weeks, to see if there's any change or any shrinking in the cervical length. The cervical length is that length of cervix, which shows that, oh, your cervix is getting shorter and is getting effaced, which could signal preterm labor or weakness in the neck of the womb. Doctor, good evening. You saw your menstruation May. Since then, you've not seen your period again, and you're not pregnant. What could be the problem? Obviously, it's hormonal imbalance. There's something wrong, or probably you have some fibroid or blockage in your cervix, which is likely to be hormonal imbalance, definitely. So get your hormonal test done. Doctor, you came across a post this morning about pregnant lady with twins, but she ended up giving birth to one child, saying that the other fetus disappeared. Is this true? It can happen. We call this vanishing twin syndrome. Sometimes in very early pregnancy, people are carrying twins, and one of the twins miscarries, and then the body absorbs the pregnancy tissue and it goes away. It can happen. It's very common. Trust me. Okay, that one is true. How many times can someone undergo C-section? I did third one 12 days ago. I would suggest once you've done 3 C-sections, okay, I would suggest stop it. don't even go near pregnancy again. If you want to prevent pregnancy, use contraceptives that are very reliable. Having unnecessary C-sections can lead to death, can lead to you losing your womb or you bleeding severely, and other complications of pregnancy. So if you've had 3 children, 2 C-sections, I think you should consider putting close and lock the shop. Please, lock the shop. There's a question here that I saw about something that just went off. Thank you, Vivian Deco Briggs. What can someone take to boost estrogen level? You can use some vitamins, but estrogen levels, I don't know what you can give to boost estrogen level. But there are a lot of vitamins that people take, Fertility, DHEA, to help ovaries, to do their work well. But I don't know what you can do specifically to boost estrogen level. What with a woman who is pregnant? Okay. Gestational high blood pressure diagnosed at 36 weeks pregnancy. Now you're 35. Now you're 8 weeks postpartum. You're taking methyl dopa 250 milligrams, but the BP is still elevated. Is it normal? No. If your BP is still high 8 weeks post delivery and you're taking methyl dopa is safe in pregnancy, but it's not a very, very good medication to manage blood pressure. But apart from all the good medications to manage blood pressure, most of them are not good in pregnancy. So we use the safe ones in pregnancy, labetalol, methyl dopa, but they are not very, very good in managing blood pressure in the long term. A quarter to half of people that have blood pressure problems in pregnancy will develop blood pressure problems later on in life. So therefore, what we do is that once you've delivered your pregnancy, your baby is fine, we try and check your monitor your blood pressure, and then we switch you to better medications for managing your blood pressure for you to take, okay, after delivery. There are better ones like the enalapril, the bisoprolol, and so on and so forth, which you can take, even the bedoflumethiazide, which you can take after delivery. But it should be taken under guidance of a doctor because they can crash blood pressure. You're given methyl dopa because you're breastfeeding. That's okay. But you should see your general physician, if possible your GP, so that they can switch you to a better, more reliable treatment for blood pressure. Enalapril is safe, even if you're breastfeeding. Doctor, does tying of tubes when you are done with child have any side effects? No. Okay. Good evening, doctor. You're taking Palodel since 2 months now. Your doctor said come in 3 months. That's okay. But I should suggest that after 2 months, get your prolactin level checked to know what's going on. Your HSG showed last week on urine and blood positive. Or HCG so that you're pregnant. You did urine and blood. Okay. And you did a scan. It says nothing. 12 weeks gone. You did a scan. Nothing was on scan. And you are 12 weeks pregnant. I don't understand that one. If you are 12 weeks pregnant, scan will show it. There's nothing, there's no argument in that one. I've been doing this for the last, since 2002. Almost 18 years now. So if you are 12 weeks pregnant and they can't say anything on scan, there's no pregnancy there. Just forget it. There's no argument. It's that the pregnancy is in the womb or outside the womb, and we'll see it wherever it is, except that person is not scanning you. Case closed. Don't let us start talking jabajantis here. Okay? There's no... Forget that. Let's just move on. Your cycle is 28 days. You see it's 26, 27 days, 29 days. That's okay. So it's not a problem. Doctor, good evening. If one sees menses twice a month, is it okay? It can happen. It can happen. Okay? It can happen. Thank you so much. For those that are interested in joining ATG Antenatal Services, GTC, we have a group for GTC. GTC is getting ready to conceive on Telegram. You can join that group. It's available. Dr. Esther's manages that. We also have the premium services. We have the 1-week consult, 1-month consult. We have the gold service, the video consult, and diamond service. You can join any of this. And through these services, you can get one-to-one contact and one-to-one discussion with me to go through your results. And I always tell people all the time that if you do your test at the ATG laboratory, you get free access to consult with me for me to go through your results. If you've done your test at the ATG laboratories, our staff members there, my manager, Nike, she'll give you the information on how to get to me, and I'll go through your results, okay? So, and also at the ATG now, we also have a new IVF center. We are doing things and amazing, and we are moving with strides. If you need IVF, now is the time to get booked as soon as possible. And if you need IVF, you see, regularly we'll be giving out discounts. Now we do IVF at ATG Center and it's getting cheaper. We've separated the cost of IVF from cost of the medication so that you can pay your medications yourself or buy them yourself, and then we can easily manage our cost for IVF, which is what we are doing now. But the prices are not stable because the dollar is affecting Naira. It's important that you call on Monday if you need IVF and get booked as soon as possible. Just by depositing half alone, get your feet in the door. Get your foot in the door. By depositing half alone, get your feet in the door, and you can start your investigations and your treatment. And at the time you come for egg retrieval, obviously you balance your full fee, but that gives you time to prepare. It's important you do this as soon as possible. So get this done. If you need IVF, call on Monday, speak to Nike and tell them. And if you attend our ATG seminar coming next week Saturday, I've got discount for those that attend our ATG seminar so that you can get some discount if you're going to get your IVF done at the ATG IVF Center. For now, ATG IVF Center is only in Lagos. I wish we can have branches all over Nigeria, but if you know what it costs to open an IVF center, you have mercy on ATG. ATG has come a long way. We started this program with an online group, but later on we took strides to open things and to make things better and to get closer to you. Okay, let's continue with our questions here. So for the address of the ATG IVF Center, it's already been put up on the screen by Vivian, by Gloria, by Onyinye, by Christina, and so follow the links and then join and call Monday to get registered. And also we have our platform on Instagram here where you can watch us on a video on Instagram. We have our YouTube channel now, which is gaining traction. So if you've not yet, by being on the YouTube channel, you can watch our videos in sequence about ovulation, about fibroid, hysteroscopy, laparoscopy, and so on and so forth. Watch them on our YouTube page. So question here from Henrietta. Doctor, what is the cost of seeing Oj? Oh, it's gone again. Doctor, I did the scan yesterday at 8 weeks. The fetus is fine. Heartbeat was detected, but after my second dose of iron supplement yesterday, you were feeling something. I lost that question. It's gone. But anyway, it's good that you've done your scan and baby is perfectly okay. That is good news. Doctor, what's the cost of seeing period with every flow prolonged every 19 days of cycle? Probably you have fibroids, okay? Or you have uterine polyps. How much is your IVF? IVF is not one price. For example, if someone needs IVF and is using their own sperm and egg, it's a separate cost. If someone is doing IVF and they're using their own egg but donor sperm, it's a separate cost. If someone is doing IVF and they're using donor egg, donor sperm, it's a separate cost. If someone is using surrogacy, it's a separate cost. If someone wants to freeze their sperm or freeze their egg, it's a separate cost. So there's no one cost for IVF is £1. It's not like that. It depends on your circumstances. It depends on what you need. That is why you have to call the office so that they can go through your information. Or if you even don't know what you do, just call the IVF center on Monday, see our doctor there. She'll go through your results, tell you the test you should do, and then we'll know what you need, and we can even tell you what kind of IVF you should need. But the fact that most people coming here watching me, they already know what's wrong with them, at least to an extent. So they will know what they need. And so most people doing IVF today, they've checked 1 or 2 places before. They have an idea of what IVF is. In fact, they even know about IVF even better than me, because they've gone around. So if you know what you need, just call the center tomorrow on Monday morning. Nike or Yemi Beckers, our nurse, will go through the IVF list with you and tell you what you need, and will give you a full summary and the full cost. And if that suits you, then register as soon as possible. You can even pay a little and start paying installments, okay? And they'll create an account for you so that we know how much you paid, how much is your balance, okay? There's a question here about semen test. 18.2 million per mil, blah, blah, blah. Yes, it's low, but you should take Adezua and Pre-Seed and have regular intercourse. As far as there's no blockage in your tubes, there's no issue with ovulation, and the womb is okay, have regular intercourse. Can someone with fibroid get pregnant? Absolutely, yes. Someone with fibroid can get pregnant. Yes. Idogo Jennifer, I've answered your question. Faith Ekupe, I've answered your questions too. Thank you, Gloria. I can see your information here. And I've unfortunately forgotten about Instagram. If you're watching on Instagram, hello, good afternoon. So you can put your questions up. Let me quickly check Instagram questions, okay? Because I've neglected Instagram, so I was talking on Facebook. Right. Doctor, what food and supplements can one take in preparation for IVF? There's no bad food. There's no good food. Even good food, if you eat it inappropriately without discipline, it becomes bad food. What you need is balanced diet, regular exercise, lose some weight, bring your BMI down to 30 or less, and see God do wonders, and have regular intervals before your IVF, of course. What can you do to Jesus? Idoro Jennifer, I've already answered your question, okay? Let me answer other people. Doctor, what are the procedure to conceive a boy? Gender selection is available at ATG IVF Center. We'll talk about gender selection as well on the ATG IVF on the ATG seminar coming next month. We'll talk about gender. So come and join the seminar. You hear what you need to do to get the particular gender you want, or what we call family balancing. You need to talk to Dr. Awoni, you want to talk to me. So Gloria or any of our team members there, can you get across to Awoni Yajoke, and give her the information on how to join our premium services so I can talk with her as soon as possible. What drugs can one take to boost ovulation? DHEA is a good vitamin supplement. Dopemu is a good thing, but you need to know how to take them and how you should take them. For that, go to our ATG premium services and I'll get back to you as soon as possible. What is the best way to eliminate fibroid? Surgery. That's the honest truth. Surgery. Your period is 28-29 days. Is it normal? Absolutely normal. Can a woman give birth at 33 weeks without complications? Isa Yvette is asking, can a woman give birth at 33 weeks without complications? Possible, but very unlikely. Can a woman give birth at 33 weeks without complication? It's possible, but it's very unlikely. Okay? All right. The best way to eliminate fibroid? Surgery. Surgery. Medications that will eliminate fibroid or make fibroid shrink will make you not to ovulate. And if you're not ovulating, it's not good. You're not going to get pregnant naturally. Your question is so... When I click it, it goes away. I don't know why. It's something about 8 weeks pregnancy, but when I click it, it goes away. I don't know why. What causes fibroid in a woman that has a normal cycle? That one, ask Jesus. So, Mrs. Chim Jesus Pat. Ask Jesus for that one. I don't know what will make a woman have fibroid from nowhere. We don't know. Fibroid is caused by so many things. Nobody knows the exact reason why people have fibroid. But once we see it, we deal with it. We leave it alone or we take it out by surgery. What can be the best family planning for someone can do? There's no best family planning. There are many types of family planning, and it depends on what you need, what you prefer, your health situation, and your plans for future pregnancy. All this and much more will let us give you advice to tailor down which one is best for your case. What is best for your friend might not be best for you. So there's no best contraceptive. What is good for you might not be, well, even what I think is good for you might not be what you want. So we need to know what you want, what you think is good for you, your health situation, your future family plans, and other factors as well. We take everything into consideration while we are advising you, so you can know what will work for you. Because what works for your friend Joke might not work for you, Cindy. It all depends on each individual circumstances. What can a woman take to stop vomiting in pregnancy? You can take antiemetics like cyclizine, ondansetron, prochlorperazine. You can also use ginger biscuits, they all help. There's a question here on Instagram. When are you coming to Ghana? Maybe next year. Once all this coronavirus vaccine issues is resolved, I would love to be in Ghana again, because last time I was in Ghana in 2019, I had a wonderful time that year, August. About 2 years now exactly. It was a wonderful, fun, lovely time. I met a lot of people in Ghana, in Accra, and I had a lovely egusi and in a wonderful restaurant. I don't know where it is again, in the central part of Accra. The Accra is so beautiful, it's so peaceful, and I love the cool side, beautiful side. In fact, I even did a dance video in the that place where it's very close to the ocean side, where there's a big black star of Ghana, lovely thing like that. And I did a video there. My wife did a video for me. I was dancing. Amazing time in Ghana. Ghana is so amazing, and I can't say more than that. I want to be there once again, and it's so beautiful to be there. Priceless Gift is asking up for the link to join the gender selection seminar. Please, team members, can you give Priceless Gift the link to join the seminar for next weekend? How can someone increase the chance of multiple pregnancy? Does Clomid work? Clomid is to make you to ovulate if you're not ovulating. Now, Clomid too can damage ovary. So we need to use Clomid cautiously, judiciously, and religiously. So, because Clomid can make you get multiple pregnancy, true, but it can also destroy your ovary. So if you're going to use Clomid, it should be done only if you need it and under supervision of a medical professional. So there's a question here on Instagram. Doctor, answer me. Does egg finish in female ovaries? Egg can get exhausted. Yes. Your eggs can get exhausted. It's true. Your eggs can get exhausted. And as we get older, eggs do get exhausted. Okay? FSH 2.7, is it normal? It's okay. What can someone take to boost ovulation? Regular exercise, DHEA, Dopemu, they are used as far as needed. Is it possible to have high prolactin and have regular period? It's possible, but very unlikely. Sperm count 50 million. Can it produce healthy pregnancy? Adeola, it can. It can. But if your sperm count of your husband is about 15 million, I suggest you use Adizua and also use Proxid during sex. It makes your vagina very, very comfortable for your husband's sperm to move faster and to do their job as soon as possible. Please, can a gestational sac be empty during early pregnancy? It can be empty, yes. In very early pregnancy, sometimes pregnancy is so tiny we don't see anything in the gestational sac. That is the pregnancy sac. But with time, usually from about 6 weeks onwards, we should see something. If you're about 6 weeks and we can't see pregnancy in your gestational sac, it's not a good sign. Not a good sign. So yes, it can be empty, but it's not for long. Not for long. So I suggest you repeat your scan in about 10 days from the last scan. Okay. How long can one stay before getting pregnant? I don't know. You can get pregnant now. It all depends. So that question is blank. How long can one stay before getting pregnant? Afterwards. Is after a fibroid surgery, I'll say 6 weeks. After a previous after a fibroid surgery, I'll say 6 months. Sorry. After a C-section, I'll say 6 months, yeah, or 12 months. So it all depends. Your question was not. It was incomplete. How can I get a procedure for IVF? Yes, Taiwo Lawal. To get the IVF link, see. In fact, Christina has already answered. Thank you, Christina. Taiwo, Christina has already given you the link to call the lab on Monday for the IVF payment, so you can pay for your IVF as soon as possible. And if you need fertility test to be done, hormonal profile, and you want me to go through your results, go and get them done at the ATG IVF Center Laboratories. And Nike or Cynthia or Niemi Beck is there. She will tell you how to send your information to me so I can go through them. Babala Oderemi, 8 weeks gone baby is fine with scan done yesterday, but taking second dose of iron supplement. This morning you've been feeling mild stomach cramp. It can happen. So take some omeprazole and Gaviscon, okay? Babalola Tulilope. I've been trying to get your question, but it goes away from my screen all the time. Thank you so much for that question. Okay. Doctor, answer me. What? Okay. Joyfulness, I've already answered you. Okay. I'm in Instagram family. Today we have about 30 people. Today we have Instagram so full. My Instagram people, I'm so sorry. Sorry that I missed your questions. I miss you. So sorry. There's a question here. Can ovarian cyst delay pregnancy? No. Except the tubes are damaged. If the tubes are damaged by the ovarian cyst, it can affect pregnancy. How can you cure ovarian cyst? Yes, you can get them removed through surgery if they are more than 5 centimeters in size. Good. Okay, so let's go back to Instagram. There's a question here that says, please, doctor, I asked this question on Facebook but wasn't answered. Why is it that for every pregnancy, if I don't take progesterone injection immediately, I lose it? What should I do to prevent subsequent so and so? Okay, good. What can you do? If your progesterone is low in early pregnancy, it means that it will affect placenta implantation and it can cause miscarriages. Maybe that's what's happening. So that's why you need supplements like dufostone, cycloges to prevent such miscarriages. So that if that's what you need, then that's what we need to give you. So why is your body not producing progesterone enough? Is a big question for me to answer, not for this screen here. So, but if that's what you need, then we have to do that all the time in your first 12 weeks of pregnancy to reduce the risk of miscarriage. Yeah. Thank you, Lizzie, for checking out on Instagram here. Thank you so much. Doctor, you need the link for antenatal. Please, guys, can you hear me give Alalade Bola the link for antenatal services on Telegram so she can join the Telegram group for antenatal service. With high prolactin, regular menstruation, is it possible for me to ovulate? It's possible, but unlikely. Unlikely. Get the prolactin treated. Somebody has got FSH 11, prolactin 201, progesterone 1.49, LH is 22.4. Is it normal? Your LH is sky high. Get a scan done. We need to check that you don't have polycystic ovarian syndrome. And repeat your LH again in 6 weeks' time. It's too high. Your prolactin also appears to be a bit borderline, but it's normal. Okay, prolactin 22.5 is normal. Okay, that's it. So let us wait a bit and get more questions, and I will go and get ready for business of the day. So the question here that is the thickness of the endometrium essential for IVF? It's important too. There's a minimum thickness that the endometrium must be to facilitate and to make IVF successful. So there's a minimum thickness of the womb cavity that we want the womb to be for IVF. Okay. Hi, good day, doctor. You just want to say well done. No questions today. Thank you in this kitchen. God bless you. Can infection delay pregnancy? Yes. If infections that you had before has damaged your tubes, it can delay pregnancy. Is Chiamaka, I forget to answer your question, but you are still back again. You are taking on Aldomet. Is it good for new pregnancy? Aldomet is safe in pregnancy. Aldomet is safe in pregnancy, okay? Good evening, doctor. Is pregnant care conception good for women trying to conceive? Yes. All right. Thank you, Christina Oladumoye, for answering and for being here. I can see your fingerprint. And Liz Queen is also moderating for us on Instagram. Thank you, Liz Queen. God bless you. What can one do to boost sperm count and motility? Adizua and pre-seed. Adizua and pre-seed. Side effect of Clomid: it damages the ovaries. It can increase the risk of ovarian cancer in the future. Is it compulsory to remove polyp in cervix? If you have polyp in cervix, depending on the size, depending on the location of the cervix, yes, you might think of taking it out. And I'll suggest to take it out. That's my honest truth. So that we can take it out, it's gone. We check it under histology to ensure that it's not something sinister or dangerous, and then we close the case as soon as possible. Thank you guys for being here. I need to go now and get ready. Thank you guys for being here. I love you all and I appreciate you. I hope to see you later again tomorrow. All things being equal. God bless you. Have a wonderful weekend. Bye.